So is everybody in the class now? Class, you all hear me?
Yes, Doctor. I think not all of us in yet.
Sorry, not all or all in?
Not all.
So you want to wait couple minutes or we proceed? Not all mean how many not in yet? We give
It's supposed to have 100 plus, but maybe some of us are sharing device, so I'm not sure. Like the
okay,
answer.
never mind. We give about I'll maintain this on my PowerPoint. We'll give 5 minutes, yeah? Then
Alright.
I will start. Okay?
Okay,
I'll
Doctor.
start exactly at 10:05.
Okay.
Thank you. Yeah.
Hi everyone. May I know how many students in this class?
Hi, Doctor. Supposedly we're gonna have like 115.
Sorry, I can't hear you.
Doctor, can you hear me?
Yeah, very soft.
Doctor, can you hear me?
Yes.
Okay. We are supposed to have like 150.
123.
15.
115. Okay.
Yeah.
So 115. Okay. Dr. Bashir is here. Dr. Bashir, are you
Yes.
ready to take over?
Yeah, I'm just waiting for everybody to come in,
Yep.
but I'll start at 11:05, another minute to go. But you want to say a few words to introduce the class, introduce introduce the what they call the subject, Dr. Tan, or you want to do it?
Okay, so I'll just explain about the course synopsis now, if you don't mind, so I don't have to take your slot this afternoon.
Okay, take your time, but take your time. I'll come in after you finish, no problem.
Right, hold on a sec. Thank you. Just bear with me, guys. I have sent the updated synopsis to your class rep yesterday. Okay. So can you see my screen?
Yes, doctor.
Yes, okay. Thank you very much. Yeah, I thought I was planning to go through this in the afternoon, but well, I think I'll just do it now. Well, basically it is a straightforward um, synopsis. The course is difficult, but then the synopsis is straightforward as other course synopsis. Right, so you are in veterinary clinical medicine too, BPK 3614. This is a continuation advanced course from 3612 and 3613. Okay, and these are also prerequisite to, 3612 and 3613 are also prerequisites for 3614. So if you fail any of these courses, then you will not be allowed to register. Okay, so I need information from the class rep on the list of students who fail 3612 and 3613 because we won't be able to allow you to sit for the course. Okay, the reason being is that, well, this is an advanced course. You need a good basics, and I have doubt that you could actually go through this course without passing 3612 and 3613. Okay, so Siti Nurliana, I'm expecting the list before 8 o'clock today. Right, so I'm the course coordinator. So the learning outcomes, well, the first one is to be able to relate the presenting clinical signs with mechanism of body dysfunctions and differential diagnosis for different body systems. Okay, so this is C5 and CTPS. What does it mean? C5 is the level of knowledge that you should attain from this course. So there are 6 levels, okay, and this is the 5th level. So this is sort of like a level of difficulty for this course. CTPS are critical thinking. So this is what we're going to polish throughout the course. Secondly is to perform physical examination and appropriate diagnostic procedures for the body systems. Physical examination, this is referring to a special examination, okay? So certain body system have been covered in 3613, and the rest of the body system which has special examination is covered in this course, okay? And then explain diagnostic findings and principle of treatment for specific body system dysfunction. So this course, again, advanced course, it covers various diseases of the body system, particularly systems that have special examination. Okay, musculoskeletal examination, lameness examination, cardiovascular examination, neurological examination. So those are the examples of the special examinations covered in this course. And we will put a lot of emphasis on formulating differential diagnosis and principle of treatments for specific diseases. Okay, and there are subjects that will cover special diagnostic techniques as well. So lecture online 11 to 1 p.m. This is, you already know. Wednesday practical. Again, the class rep, well, some practicals will be done online, but some practicals will be done face-to-face. Okay, so please liaise back with the specific lecturer and see what they prefer. So then just to avoid disappointment, because there's a lot of scheduling has to be done. And of course, arrangement in terms of, maximum number of students to be allowed in one space if we are about to have face-to-face practicals. Okay, teaching method practicals, same thing. So course introduction, lecture content, mammary gland, and other musculoskeletal system. So mammary gland, so this also has special examination comes together with it. Musculoskeletal system, equine, cattle, and small animal. Ocular system, which will covered by Dr. Amilan. So this is a lecture we invited from AMC. I will cover the nervous system. Auditory system will be covered by Dr. Chan Wei Yi and Dr. Gayatri. If you remember in 3613, you had lectures on dermatology, but not the practical. So some of the basic dermatology techniques will be covered in here as well. Cardiovascular system. So practical content, same thing throughout. Ocular system would have one, nervous system would have 3 practicals, auditory, gastrointestinal. Again, this one also not being covered in 3613, and cardiovascular. So timetable, I'm sure you have seen this. We have first test on the 10th of November, 8 to 9 p.m. at night by Putra Blast. Okay. Then 22nd December for test 2. And I think there will be coursework throughout the semester as well. Okay, and we have revision quiz and completion of coursework before going into your study week. Okay. So this is the distribution of marks. And final exam is actually 40%. So these are the best references I could offer you here. Okay, so this is again is quite a difficult course to score. So therefore, I don't suggest you to miss any lectures and practicals. And all lectures will be recorded. Then we will upload it and either last time I actually placed them in Google folder, so we can do that as well, and you could have access to them. So other than that, that's basically it, So any questions so far? If not, then I'll pass over the class to Dr. Bashir.
Thank you, Dr. Intan.
All right, thank you, Dr. Bashir.
Okay. Okay, Assalamualaikum and good morning, class. Do you all hear me and can you see the PowerPoint?
We cannot see the PowerPoint.
You cannot see PowerPoint? Let me.
You have to reshare your screen.
Okay, I'll do that. Just 1 minute. Okay. I'm looking for my WebEx meeting again. Just 1 second, yeah. Okay. I lost my screen. Just 1 second, yeah. I know where it is.
Okay.
This one. Okay. Okay, got the screen.
You, sorry,
Uh,
I'm not sure whether this is me. Your voice is very soft. It's like you
Yeah.
are further away from the microphone.
Is it? Let me see.
Yeah.
I'll put in first. I'll try to share the screen first. Just 1 second. Okay. Can you all see the screen, class?
Yes, doctor.
Yes.
Yes. Okay, good. I think we are okay. And how's my audio? Is it okay and clear?
Yes, doctor.
Okay, good. So
Yeah, it's very clear.
okay. Now I think this is the first lecture, not only on my lecture, but it's for the 3614, right? So basically, this is a battery medicine lecture. I'm given the task to cover on the musculoskeletal system. But there's only 2 lecture and 1 practical. But bear in mind that when we talk about musculoskeletal and the topic or the subject I'm going to cover is musculoskeletal system or disease of musculoskeletal system in horses. You must remember uh, this is basically I took this as an introduction to the disease of the musculoskeletal system in horses, which will be done in the equine medicine lecture. Uh, Bear in mind, in equine diseases, 60 to 70% of equine cases in practice are musculoskeletal. So by weightage, not even 2 lectures, but 2 credits not sufficient. So more detailed diseases will be discussed in equine medicine. My intention today is basically to reinforce on the basic medicine you have done on the what they call veterinary medicine, now specific on musculoskeletal system. I will cover on the approach towards clinical examination. I know that you have done physical examination in horses and also with emphasis on the musculoskeletal system. So what we are going to do in this couple of lectures is for me to introduce the detailed clinical examination, which is very important towards the examination of what they call musculoskeletal system. And I will pick up 1 or 2 condition only as a guide for you all to see the approach or the flow in diagnosis of condition of musculoskeletal system in horses, such as a case being introduced, how you do the clinical examination, what are the aids of diagnosis that you can use to rule out some of the differential and come out with the diagnosis, the final diagnosis, and probably 1 or 2 simple treatment. The detail will be done in the equine medicine lecture. And for the practical too, I've decided, I informed Dr. Intan that I will be taking online this afternoon. The reason is there's not much different from your approach to the physical examination in horses that you have done last semester, correct? Have you done physical examination in horses in medicine lecture last set? Class, you all hear me?
Yes, Prof.
Yes,
Last 2
sir.
semesters, I think, during clinical skills, VPK 3612, I think.
Okay, since you have done, basically to me, there's not much difference in the clinical examination of musculoskeletal system in the horses. Examination of the hoof, the legs and whatnot, which is the important part, of course, including other parts of the body. But what is important in detail in the practical is very difficult to get everybody in and also to get actual many cases of lameness. So what I'm going to do I will do it online this afternoon. We'll see we'll discuss detail of how to detect lameness in horses, and then I will show you some videos so that you will understand. So it make not much different online and what they call face-to-face lecture, because before, when we were doing face-to-face, so I will have the class in to show the video, which is a lot easier to see and understand. So the other thing is, you realize the notes or the slides here, there is detail, what they call notes below it, footnotes, right? Do you see the footnotes? Probably not, because I'm projecting the whole what they call full screen PowerPoint. But do you have access to my lecture note yet for this PowerPoint?
We have it from our seniors.
Okay, you check the system. If not, I will communicate with Dr. Intan. This is the same note that I prepared last year. The PowerPoint was prepared specifically for COVID condition, which means there's a detailed footnotes there, a very, very detailed notes I prepared for you all to understand. So if you see the slide, you read the notes in detail, you will understand the lecture too. So I think it's not usual for me to do this, but since last year, I can't meet the student, so I prepared and I expect you to go through. So go through the slides again, read the notes. It's very, very detailed. You will understand it. And of course, from reading the notes, thing that you don't understand, you look at some of the referral text, or you can always communicate with me. Okay. So I will start the lecture for 2 hours. It won't be long. As I say, I've got full notes there, so I can go a bit fast. Go back and read the notes. You can always chat with me or talk through while I'm giving lecture, just like usual lecture that I used to do. You can stop me halfway and discuss. And for this afternoon, since we finish this about half hour, 45 minutes, we take a break. It's already almost 11:25 now. I think by 12 we finish. We'll take a break of about 5 to 10 minutes. We do the second lecture. Then the practical, to give you some break, we can start at 2:30. Is that fine, or you want to follow me giving the lecture right through 2 lectures completely and finish earlier, and you start the class at 2 or 2:30? Tell me. What do you prefer? Class? Okay, practical, what time you want to start? 2 or 2:30?
2:30 is okay.
Okay,
Okay,
2:30
Prof.
is okay.
2 also okay. Which one
It's up to you.
is it for Prof lah?
Authority. What's okay, never mind. Towards the end of the second lecture, you decide at 2 or 2:30. I think we do at 2:30, less tiring for you all. And then it won't take long. I think by about 1.5 hour we'll finish. Okay. And for this lecture 1 and lecture 2, you want me to continue? You want to take a 5-10 minutes break? Doesn't matter, is it? Okay.
It's up to you,
Break, Prof.
Doctor.
Like 5
Sorry?
minutes. Kalau 5 minutes break also can, Prof.
Okay. Okay, we take a 5 minutes
Prof can
break.
relax.
So the first lecture, an introduction to the musculoskeletal system. So when we talk about musculoskeletal system, irrespective horse, cattle, sheep, goat, whatever it is, or even humans, basically musculoskeletal system, one of the important function is organ of support. It constitutes this four structure. We're talking about muscle, tendon and ligament, bones and joint. Any of these are component or combination, they are all under the musculoskeletal system. Why I mentioned this is that any condition involving muscle, tendon, ligament, bones, and joint, these are all condition of the musculoskeletal system. Now, for musculoskeletal system, and I'm talking about general first. general sign. It is important for you to understand or to be able to detect the sign of condition. I usually mention as condition because most diseases of the musculoskeletal system are non-infectious. They are usually trauma related to use. There are many physical factors involved. That's why it's not surprising that in many texts they refer disease of musculoskeletal system, each disease as condition of musculoskeletal system. So through your reading, whether it is condition of musculoskeletal system or disease of the musculoskeletal system is the same. Okay. For example, we take myositis. Some say myositis is a condition of the musculoskeletal system. Another book will say myositis is disease of the musculoskeletal system. So it doesn't matter. I usually use terminology condition. So you are not familiar. If I mention condition of musculoskeletal system, it means disease of musculoskeletal system. So signs of disease or condition of the musculoskeletal system, there are 3 or 4, but one very important one, which is lameness. So, and this constitute to about 90 or 95 or maybe more than that as the signs of musculoskeletal system. So lameness is the most common sign of musculoskeletal system. Basically, when we talk about lameness, it's very important. The rest are signs too, but they are less common. But they are seen depending on the type of condition or disease that you see. But lameness is one important one. Any condition of musculoskeletal system, 95, 99% are lameness. Now, generally, we can classify lameness into 2, weight-bearing lameness and non-weight-bearing lameness, which means you're talking about the legs. Most of musculoskeletal system condition are seen on the limbs. So it means weight-bearing lameness is that there is problem at the legs, but the horse is able, not only horse, any species, they are still able to bear weight. Weight bearing, that means they be weight borne by the problem leg. In many species, especially horses, they be even walking normally without signs of lameness at all. So those are weight bearing. Non-weight bearing lameness are lameness. It also reflects to the severity of the pain that the animal or the horse doesn't bear weight on the affected leg. Okay, so there's 2 class, but this is a very simple classification. In a minute, I show you a more detailed, more objective, precise, what they call lameness classification, which are a lot more detailed, a lot more easier to qualify and quantify. So, other than lameness, there could be other signs. So you might see in combination or you might see one only. The other sign, which as I mentioned, the following 3 signs are less common compared to lameness. Abnormal posture and movement. Let me go back to one again. For example, weight bearing, any simple mild lameness, they are weight bearing. Non-weight bearing, for example, in very severe case, for example, a fracture. When a fracture, they do not bear weight on that particular leg. So those are example of non-weight bearing lameness. Abnormal posture of movement. Abnormal posture means, the positioning, the standing are not normal to the species or the horse, I would say. Now, example is recumbent. When the effect on the musculoskeletal system is so severe, for example, there is multiple fracture, severe fracture of femur, humerus, and whatnot, that the animals are not only not even able to stand and bear weight, they are recumbent. So that's abnormal posture. So when animal is recumbent, you see a sign of recumbency, there is a possibility of musculoskeletal. But of course, these are assigned to other condition too, other system too, like general system, weaknesses, system involving the nervous system can cause recumbency. See? The other one is movement. Movement means the movement is abnormal but not lameness. Lameness reflect to pain after when we do the practical, or I show you on the slide, you'll be able to represent. These are more like stiffness. Stiffness might be a sign, so this is abnormal movement. Or if there is arthritis, for example, causing pain or what they call fusion of the joint, that the particular joint is poorly flexed when the horse is trotting or galloping, whatever. So poor flexion is an abnormal movement. Number 3 is deformity, abnormal shape, size, disposition. For example, there is a new bone formation in the joints. Or if there is a fracture, with the fracture, it heals without poor alignment of the long bones, for example, cannon bone. It causes deformity of the leg, right? So that's also what they call signs of musculoskeletal. Number 4, ESO fracture. ESO fracture is a disease, is a condition that causes, for example, resorption of calcium from the bone become brittle, easily fracture. So when we say ESO fracture, fracture is a condition, ESO fracture is a sign, basically. Why? Because the bone is easily fractured, which means under normal force, a normal bone will not fracture, but a weakened bone can easily be fractured. So if there is what they call complaint of fracture, which easily happen without even strong force on the limb. For example, the horse was just trotting around, not putting pressure, and all of a sudden it had a fracture. That shows that there is ease of fracture, which is a condition or a disease. Okay, so these are signs. Are you clear? Are you clear with the? Okay, good. Now, we go back to the first slide just now. I did mention about lameness. Lameness actually is very important for you to understand, because 99% of signs of musculoskeletal is lameness. So you must be able to know what lameness is. You must be able to identify lameness, and you must be able to grade the lameness. As I mentioned, simple classification, non-weight bearing and weight bearing. A more detailed, more objective classification of lameness or grade of lameness is we call it the AAEP's classification of lameness, which is the American Association of Equine Practitioners. They come up with a more detailed classification of lameness, which probably may make our diagnosis or grading of lameness or degree of lameness better. Actually, just now you see the lameness is only divided into two group, non-weight bearing and weight bearing, depending on whether they are able to bear weight on the problem or affected leg. Whereas AAP's classification, which I use this all the time, many people use this classification, there is 5 grade, I call it the grade of lameness, 5 grade of lameness. 0, I just put it in to indicate. So the grade is from grade 1 to grade 5. 0 mean lameness, 0 mean what they call there's no sign of lameness at all. But of course, you don't say grade 0. 0 means normal. Okay, the horse is sound. Now, the AAT's classification of lameness is 1 to 5. Yeah, the grade of lameness. That also indicate the severity of lameness. The number 1 is less severe condition. Number 5 is a very severe condition. Now, grade 1 lameness is lameness that is difficult to observe. Remember, in horses, maybe now you probably be wondering how you identify lameness. This afternoon we'll be doing the practical. I think you have done it in the medicine class last year even, that lameness in horses or other animals, but mainly horses, lameness is identified through a trot. You trot the horse, that means you have got to move the horse, you trot them in a straight line and basically observe. In this afternoon, I will what they call detail what is a trot and what not. We don't have time here. So you detect through a trot. So when you trot the horse to examine for lameness, lameness is very difficult to observe, which means you can't really see the lameness. But the owners complain that the horse is lame. He might be right. Okay, especially when riding, he feel a slight lameness. The horse is not right, but when you trot the horse, you don't see any lameness. So, so in between, the horse is normal, or maybe it's lame, but the sign is not severe enough for you to see the lameness or the head nodding, we call it. I will what they call discuss in this afternoon. So that's grade 1. There is a problem, but you are not able to observe the lameness or the head nodding. Grade 1. Grade 2 means lameness is not consistent. You know that lameness is detected through trotting, right? So when you trot the horse, remember last year when you did your practical with Dr. Aniza, I think, is it Dr. Aniza that take the class? Practical?
We had our practicals online as well.
Online also. So yeah,
Yeah.
I can understand that it's a bit difficult. So, but never mind. I will. You. If you're not clear, we discuss this afternoon. So you trot the horse. When you trot, lameness is detected through a head nodding. I will discuss detail this afternoon. So when the horse head nod, the nodding of the head indicate lameness. But usually when you want to detect lameness, you trot the horse away from you and trot back towards you for about 30 meters for you to judge the lameness. So when the horse is trotted, the head nodding is not consistent, which means through the 30 meter of trot to away and towards you, there is head nodding, but not all the time. Okay, so it take a few steps, one head nod, keep going again, a head nod. So it's not consistently head nodding with the leg touching the ground. So this there is definitely a head nodding but not consistent, which means horse will be trotting for 10 meters, looks normal, and then for another 5 meter or 10 meter, head nod, and then normal again, coming back the same. So occasionally head nod. Head nod indicate lameness, indicate pain. So definitely there is pain but mild. So that is what we call it grade 2 lameness, not consistent at trot. Number 3, lameness is consistent at trot, which means the horse is trotting and the head nod, the horse is nodding all the time. Each time the leg step or landed on the ground, the head nod. So continuously nodding his head without interruption. That is grade 3. So see the difference? Occasionally head nod, grade 2. Continuously head nodding, grade 3. Number 4, grade 4, lameness obvious at walk. Here, remember 80-90% of lameness are seen at the trot. At the walk, they are normal, as I mentioned in the first slide just now, right? Now, in this particular condition, the horse will be walking with the head nodding. That means the lameness is obvious at walk. You don't have to trot. If you trot, of course, you can see the lameness more obvious. So if the lameness is even obvious at walk, that is grade 4. Now, grade 5, lameness produces minimal weight bearing in motion or at rest. What I want to stress is at rest. In motion too, of course. So the horse is not bearing weight at all. That is grade 5. And if you look at grade 1 to grade 5, even by reading the definition, you realize that the most severe will be grade 5. The less severe, the mild one is grade 1. So it also reflects the severity of the lameness. And again, you refer to the first definition, grade 1, grade 2, grade 3, grade 4, they are all weight bearing. So weight bearing lameness is 1, 2, 3, 4, and grade 5 is of course non-weight bearing. So as in this picture, for example, the hind leg here, the horse is standing like this all the time. The same with the front leg here. The leg doesn't support the weight. The weight is not being supported by the problem leg. So this is non-weight bearing lameness. Okay, grade 5. Okay, I probably want to skip this in detail. You have done examination of the musculoskeletal system. Yes or no? Class, yes or no? You have done examination of musculoskeletal system, right? Clinical examination last sem, correct? Any reply? You are not sure? Can you all hear me?
Yes, doctor. We learned the physical examination for horses.
That's also online, yeah?
Yeah.
It's okay. So I will go through fast to cover this lecture because I'll be repeating in the afternoon. Okay, I will go through the procedure. I mean, you go through medicine 1 last sem, examination, physical examination in horses. When you do physical examination or clinical examination, when you examine the whole body, examining the musculoskeletal is detailed, right? So you have done that too, like palpation, examining the hoof, using hoof tester to check the sole. All those are done. So those are part of the physical examination. So if you are presented with a case of lameness, for example, a complaint of lameness, what do you do? So the process of clinical examination or examination for musculoskeletal system, not much different from what they call any other species, right? Or any other system. What is important is you must do a complete physical examination. That means you examine other body system too. But usually the other body system is done fast with what they call focus and emphasis on the musculoskeletal system. Musculoskeletal system means the legs, the bone, the muscle, tendon, and whatnot. Especially most, as I mentioned, 90 to 90% or 95 to 99% of musculoskeletal sign of musculoskeletal system or complaint is lameness. Lameness is on the leg. So you want to examine the legs. Don't forget that. So which means you spend a very quick couple of minutes to see problems anyway. The horse could have severe skin lesion, complaint of lameness, but actually there's a big wound after a fall. So those are more important. Those are not musculoskeletal. So you have got to do a complete physical examination, couple of minutes, but with emphasis of the musculoskeletal system. This is standard. Yeah, you need to know the history, visual examination. So I go quickly this, but in the practical afterward, I will discuss more detail. Okay, you can go back and read these notes first. The sequence will be first you need to know the history, just like any other disease, but history more related to the problem. Then you talk about visual examination. You see the horse from anterior, posterior, lateral, both lateral and whatnot as possible for you to see any obvious clinical sign. Obvious clinical sign like swelling of the joint, swelling of the muscle, weight bearing or non-weight bearing lameness, all this. So you can see it through visual examination, and at the same time, you are visualizing the other system as well. Then you do detailed examination. Detailed examination basically what they call, you need to check where the problem is, depending on the history again. After you do your detailed examination, for example, once you complain with lameness, you suspect left foreleg is lame, you examine, you look visual examination, then you try to determine which leg is lame, you go for detailed examination. When you do the detailed examination, you cannot find anything there. No pain, nothing on the leg. So the condition might be mild, is related to, for example, work only. When the horse is not being worked, they don't see lameness. A good example, if there is a mild arthritis, only when ridden, the horse will feel the pain because of the weight and the speed and the concussion. But walking is normal. So when you examine, you don't see the horse lame and whatnot, but you still have to accept if the owner complains. So maybe it's related to work. So sometimes you have got to examine the horse at work. If the owner complain that the horse is lame when it's ridden fast, the horse is lame when it is jumping, the horse is lame when it's turning in circle. When it goes straight, it's not lame. When it turns in circle, being ridden, it's lame. So when you standard physical examination, you don't do all this. So trusting that possibly there is a problem as complained by the owner, then you have got to be present while the horse is being worked. But this is done after failing to get any sign of pain on your standard examination. So examination at work is not standard. Yeah, once you have examined or you can't find anything, but the complaint or the history shows it is examined it's lame at work, then only you examine the condition at work. After you have done all this, or not including examination of work, whichever, you have come up with some differential diagnosis. For example, you examine, you found there's a fracture, you examine that you found there's arthritis, you examine, you found there's a puncture sole, whatever it is. So you come up with a diagnosis and you treat. But at times you will still have differential that you have to rule out. For example, you what they call, you examine, you think it is arthritis. You don't know whether it's chronic arthritis with new bone formation or just acute arthritis, damage to the joint capsule, damage to the ligament and whatnot. So if you want to do further, you have got to use aids or spatial diagnosis, some people call it. I usually call it aids of diagnosis. It doesn't matter what terminology you use. You probably think you need to x-ray to see what the problem is. So that's what we term as aids in diagnosis. So once you have done that, inshallah, you'll be able to come up with the final diagnosis and treat accordingly. Okay, this history I will discuss in detail when we do the what they call physical examination class. But you need to know, for example, in musculoskeletal, sometimes etiology is known. The owner said the problem horse was kicked by another horse, or the horse was ridden, fell down the hole, lost its footing. The owner was riding on a road with a lot of gravels, right? That causes trauma. Horse was playing polo, hit by the polo stick. Horse was jumping, hit the leg with on the hurdle. So ask what happened. Okay, when, how long it has been lame? Because some lameness are chronic and they are recurrent. So you have to ask when was it first lame? Maybe 2 years ago, and every 2-3 months it was lame. It might be related to work. Only when it's working hard is lame. When it's not working, it's okay. The type of lameness, what type? Severe. Okay, weight bearing, non-weight bearing, type 2, grade 2, grade 3, grade 4, whatever. Treatment, whether it has been done or not. Why? Horse owners are keen on, are common. They keep analgesic, okay? Analgesic, anti-inflammatory. Just like us at home, we always have Panadol. You feel not easy, you feel headache, you take one step, right? So horse owner, if the horse is not what they call okay, especially musculoskeletal, lame and whatnot, definitely they will treat first. What they will give is phenylbutazone, which is an anti-inflammatory analgesic. So you have to ask, why? Because when in the course of your examination, the analgesic effect is there. You might trot a horse with a complaint of lameness, but when you trot, it's not lame because it's on analgesic. Or the severity of lameness is not reflective of the condition because there's already analgesic effect. Sometimes the treatment is not effective. Other question like showing, when it was quite short, because sometimes improper showing, some horses are sensitive with the new shoe, they are lame for 1 or 2 days. So sometimes it might be related to showing, which is not, which is actually normal. There's horses are sensitive after showing 1 day, they're okay, just like us wearing new shoe, right? So ask the history. Okay. Visual examination. Conformation is important. Look for poor conformation because conformation contribute to lameness. This will be discussed in equine medicine in detail. I'm not going to discuss conformation. Swelling. As you walk around the horse, remember visual absorption, visual examination I mentioned, you might be able to see the sign, non-weight bearing. So, can you all see my pointer?
Yes, Prof.
This is good. So, swelling of the hog, okay, conformation, lordiosis here, low on the back here, right? So, or sometimes swelling of the fat log, swelling of the knee, obvious signs, right? And other obvious signs, right? Then you go for detailed examination. I've mentioned about this. I will do it the afternoon again. I'm sure you have done all this, okay? Throat, okay, detailed examination. After it is important to detect which lameness, which leg that is lame, pick up the leg, examine in detail. 60-65% of lameness is in the hoofs. Check the hoof, okay? Could be pain using a hoof tester, okay? I mentioned about what they call examination of work to be done only if the need arise. Trot, straight, lunging in circle, or being ridden. Sometimes not only that, some for example, another complaint, the horse is stiff or lame after work. During work, no problem. Before work, no problem. Only the day after work, when it's rested, it come out with stiffness. So if you are examining the horse normal, you won't see anything. So come back after the work, examine after work. So those are all examination at work or exercise. Okay. Then we use aids of examination or special diagnosis, special examination. Only when you have differential or you want to know in detail, you want to rule out certain condition and whatnot. What are the aids of examination? I will mention first this afternoon, we look into detail. Fraction test, nerve block, joint block, X-ray, ultrasound, biochemistry, arthroscopy, arthrosynthesis, many more, many more. Okay, that can be used. Okay, so these are all aids in examination. It can be used to determine the problem. Okay, okay. I think basically that finished the what they call condition or examination of the musculoskeletal system. I will only pick up 1 or 2 condition of each system for you to understand. This one also, I'll go fast. We can discuss the afternoon or we can discuss through online by communicating with me, WhatsApp, email, or whatever it is. After you have read your notes, there's a detailed notes here. So I will pick up one condition of muscle, one condition of bone, one condition of what they call joints, one condition of ligament or tendon, right? So for the condition of the muscle, After we'll take another 10-15 minutes before we take a break, yeah? Because just now I start at 10:20, correct or not? So when we talk about condition of the muscle, stop me, yeah? You cannot understand or I'm too fast. Condition of the muscle, uh, there are many conditions of the muscle that cause lameness or whatnot. One is called exertional myopathy. Okay, and exertional myopathy is basically in terms of etiology, there is a building up of lactic acid in the muscle. This is quite common in horses, but it do happen in other animals too, like in wildlife and whatnot. Development of the accumulation of lactic acid in the muscle causing degeneration of the muscle fiber. That's what it is. That's what exertional myopathy is. It's related to exertion or hard work. That's why it is called exertional myopathy. Myopathy means degeneration of the muscle, right? Now, they come in many names, right? In horses, they are usually terms either as Monday morning disease. These are layman's terminology because they usually see it on Monday. In the early days, horses are not work on Sunday; they are rested because on a rest, go to church and whatnot, right? So, but the next morning on Monday, the horse is work hard, being rested, suddenly work very hard, and then they will see the sign after that. So that's why I call Monday morning disease. It don't have to happen on Monday, this condition. You use for endurance, you use for cross-country horses at any time. Immediately after work, it might come down with this condition. So it is still called Monday morning disease, right? But I usually term it as azoturia or tying up syndrome. Very common to use this term, tying up syndrome. They are all the same. Is exertional myopathy. In wildlife, it is actually is exertion that happen during capture. So it is called capture myopathy. So the signs are all the same. More definitive pathological name or the definition of the condition, they are called post-exercise rhabdomyolysis. After exercise, right? So exertional myopathy, exertional post-exercise rhabdomyolysis, they are all the same. But of course, in horses, you don't call capture myopathy. Nobody go around and capture horses until unless you're talking about wild horses, right? So they are called, but still, if you have wild horses, you run, you chase them around, try to catch them. After they come out with exoturia, you can call them capture myopathy. It's not wrong, right? But in horses, we call it tying up syndrome or exoturia. Okay. Okay. What causes this? Actually, etiology, etiopathogenesis. Actually, it is sudden exertion. Horses work very hard. For example, endurance race of 120 kilometer, 160 kilometer, or even 80 kilometer, depending on the level of fitness of the horse. Okay, or horses that are rested. When they are rested, they are fed normal, right? So when they are fed normal, the next day, 1 or 2 days, they are rested because of honor resting. They are rested because of some disease, recovering from disease. They are rested for 1 day, 2 day, 3 day, a week or two. All of a sudden, after they are back to work, the first day they are work hard. Admin doesn't mean they are work for 3, 4, 5 hours. If a horse is rested for 2 or 3 weeks, all of a sudden they are work for 40 minutes, half an hour, 40 minutes, or 1 hour riding fast and whatnot, they still can cause myopathy. So they are all related to rest and work. So it is what happened is that during resting, when they are fed, the excess feed, the excess nutrient are being stored as glycogen in the back muscle, in the fat area, right? So when they are stored as glycogen in the fat mass and in the back muscle of the behind leg, for example. Now, when the horse is suddenly work, I think it's here. Okay, we go back. What causes it first? So it's anaerobic glycolysis resulting in the buildup of lactic acid in the muscle causing degeneration. Okay, they are usually due to rest and work after that, overfeeding, poor fitness. Also, they are not used to being worked for 120 kilometer. All of a sudden, you go and ride for 120 kilometer. Sudden increase in work to high speed, and also sometimes it's related to vitamin E and selenium deficiency. So what happened here is at rest, glycogen is being stored in the muscle. When the horse is not fit, when the horse is worked hard, the conversion of glycogen into energy goes through an aerobic cycle because of insufficient oxygen. When you work very hard, reduce oxygen ability in the blood, result in the conversion of energy through anaerobic glycolysis. You go back and refer to the Krebs cycle in your biochemistry first year lecture, you will understand. Okay, so when the energy is being pulled from the glycogen that is stored in the muscle through anaerobic glycolysis, one of the end product is like, of course, you get the product of energy. Okay, energy, work energy. But one of the end product is lactic acid. Lactic acid accumulate in the muscle. When it accumulate in the muscle, it causes degeneration. Okay, degeneration of the muscle. So you get degeneration and damage to the muscle fiber. Okay, and at the same time, the muscle have got myoglobin. Myoglobin is released into circulation. So signs, it causes stiffness with degeneration, acute condition of the muscle. It causes stiffness, it causes pain. So the horse hardly want to move. Okay, very stiff gait, as in the picture. There's pain, and I did mention myoglobin being released in the urine, right? So it makes the urine dark in color, like blood color. Okay, it's not bleeding, but myoglobin have the same red color as what they call hemoglobin, right? So you get myoglobinuria, swelling of the muscle edema. If evac most part of the muscle, it's so painful that the horse will sometimes be recumbent. Not only stiffness, but recumbent. And actually, myoglobin is released through, in circulation, is released through the urine. So, but myoglobin are quite big. It packed in the myoglobin, in the nephrons. Okay, it might cause nephrosis. So slowly, it can cause death due to kidney failure too, right? But of course, at the same time, there is not only what they call the development or the accumulation of lactic acid will also result in metabolic acidosis. So in metabolic acidosis, it is a metabolic crisis. That's how it can cause death as well, right? So how do you diagnose? History, sudden onset. They happen suddenly, but it's all related to work. The horse was worked hard. So after work, the horse becomes stiff, they want to move, okay, and all those conditions associated. So a good history. That's why I say always ask the history. Signs. We discussed the signs just now. Pain in the muscle, stiffness, red urine, swelling of the muscle, edema, walking very stiff, sometimes recumbent. These are all, and the signs are quite specific, that you can make a diagnosis of what they call exertional myopathy just based on the history and the sign alone. It's quite accurate enough. But you still can do some laboratory tests. If you take the blood, you will realize that there is an elevated creatinine, CK, okay, creatinine kinase, and elevation of AST. Okay, both this enzyme, muscle enzyme, is elevated. Why? Because of the degeneration of muscle, they are released into circulation, right? This is an example of what happened. This is a true clinical example of enzyme level, because most what they call exertional myopathy, horse presented to us, we diagnose from the sign alone, we treat. So we do not have any detailed aids of diagnosis or test or enzyme or blood test. But this particular horse, we do a preliminary blood sample before it traveled. This horse was traveling for what they call endurance, international endurance ride in the Middle East. It is a requirement that blood test is done before travel. So what happened? So that's why I got the figure. Usually we never have what they call disease, what they call enzyme level anymore, AST or CK. But here, before travel, blood was taken. So we test for AST too. AST was 310 international unit. CK was 158. So all four are within the normal range, right? Forget about the rest. On day 3, which means the horse took a flight, landed, rested. So on day 3 of arrival, another blood sample was taken for what they call monitoring. Not monitoring the disease is a standard requirement for horses that travel abroad, right? For disease control. So the AST and CK level was still normal, right? Was normal, so no problem. The horse was rested, so taken only for a walk, without hard work and whatnot. On day 9 in the morning, the rider arrived. Okay, the rider arrived because the horse and the rider don't travel together. So the rider arrived. They took the horse for the training in the morning for about 1.5 hours, 2 hours of ride, which shouldn't be done, right? Which shouldn't be done. So it's considered hard work after a long rest, right? They have 9-day rest. Then on day 9, they took a ride, morning ride, as training or exercise. In the afternoon, 6 o'clock, the horse was found to be very stiff, doesn't want to move. One horse. 5 horse was taken for a ride, only one showed this sign. Okay, so it shows a classical exertional myopathy or exoteria or Monday morning signs, right? So we treated accordingly. But at the same time, we took blood. See the elevation, 4,000 for AST, 11,000 for CK. They are very, very much elevated. So this confirmed the diagnosis, right? What do you do? Exertional myopathy. Myopathy causes degeneration, causes pain. Anti-inflammatory analgesic should be given, okay, to reduce the pain. Fluid therapy is given. Fluid therapy is given not to correct the dehydration. If at the same time there's dehydration, is good. But if there is no dehydration, seldom fluid therapy is given too. Why? We want to flush the myoglobin out from the nephrons in the kidney. If it is left alone, it can cause nephrosis, okay, kidney damage. So fluid therapy is given to flush because myoglobin get trapped in the pyelonephron because myoglobin is quite big in terms of size relatively, right? So we dilute, so what they call try to initiate urination, it keep urinating. Other treatment, there is metabolic acidosis. You probably need to use bicarbonate to correct the imbalanced acidosis because it can cause death because of all this, right? Something that the condition might be related to vitamin E and selenium deficiency. So it's also given. But most important is anti-inflammatory analgesic and fluid therapy. And to be given a rest, but not complete rest, but the horse have got to be not exercise, but to be taken for a walk. If not, it causes stiffness of the muscle. So for control again, control the work and feed. Horses have got to be reduced in terms of feed when they are rested, and when they work, immediately after rest, light work first. After a couple of days, only they get to hard work. To show how effective the clearing of the myoglobin on the sign, number 1. after dilution, after fluid therapy, okay? He keep urinating. This horse probably get about 30 or 40 liters. Then he keep urinating and the urine becomes normal. So when the urine is normal, that shows there's no myoglobin being trapped in the nephrons. It should be okay by then. So if left alone without treatment, without fluid, it causes myoglobinuric nephrosis, and that can kill the horse. Okay? Okay, that ends our presentation. Any question? Any question from the class?
No, Prof.
None from me, doctor.
You can understand, yeah? We can still discuss some of the condition. If you are not clear this afternoon, including coming lecture, we can discuss when we have the practical. So my computer shows is 12:11. We come back at 12:06. Okay, you take a break. I'm not going to off my screen, so you what they call let me see. Stop sharing. Okay, I will stay on, and then I will share another PowerPoint in a minute. I think I do it now. So you take a break. I come in at about 12:06, yeah, but I'll set already. Okay. Okay, class, are you still there?
Yes, Doctor.
Okay, good, yeah. So, any question from the previous lecture? So, kalau tak ada, I think we have done muscle just now. So, just now is a condition involving the muscle. So, I hope you now still you now can see the flow or what need to be done in cases of musculoskeletal system. You need to do the physical examination, get a good history, do a clinical examination, come up with a differential. Then there might be some aids of diagnosis or tests that you need to do. While you have done that, you come up with a final diagnosis. Then you take a look if the control need to be done, you do the control. And what I have given you is one example of a condition of the musculoskeletal system involving the muscle. Now, we go to second component of musculoskeletal, the joints. This is also going to be fast. For you to understand the flow, actually, I'm showing all this for the flow. The detail, we are going to do equine medicine in equine medicine lecture again next sense. So basically, this one will give you the principle of what will be like. So we talk about joints, inflammation. We take inflammation of the joint, which is termed as arthritis. Arthritis is inflammation of the joint. But remember, when we mention joint, whatever disease is the type of joint, right? When we mention joint, yeah.
Are you sharing the screen, the slides?
You tak dapat screen ni? Tak dapat share?
Yeah, I cannot see the slides.
Okay, aku lupa nak tanya ayah. Tadi I share the screen. Let me see. Close it. And on slide. Oh, because I got another slide now. Let me see, yeah. Share. You see the screen now?
Yes,
Okay, good. This is what I thought you were looking at it just now. So, but I was on this slide anyway. I did mention that arthritis is one example of condition of the joint, inflammation of the joint. But always remember when we talk about joints, let's say padlock joint here, joint is not what we call it a different structure in the musculoskeletal system, but it's a combination. What is in the joint? Like muscle system is basically muscle, correct? But in the joint, when we say joint it consists of bones. Not all bones that articulate the joint. Okay. So in the bones, where there is articulation, there is articular cartilage, right? So you have the joint capsule as well. So now and when there is joints, the one that joins the two bones, simple joint is two articulating bone. More complex joint like the knee joint or the hop joint may consist 6, 7 to 8 pieces of bone inside there. These are being held by ligaments. So remember when we say joint consists of bone, articular cartilage, joint capsule, and ligament. A condition of any of these or in combination and inflammation is arthritis, right? So you can have involvement of cartilage, involvement of capsule, involvement of ligament or bone. Now, what this is general condition of arthritis. They are usually related to injury. Can be direct trauma, can be trauma because of work or concussion, caused being ridden on hard ground, continuous concussion with damage to the joint. This one will discuss in detail. Poor conformation resulted in uneven distribution of weight on the joint. So when the horse is being ridden, a certain part of the joint, the medial or the lateral, depending on the condition, might not be very weight equally. So in terms of wear and tear, chances of it being damaged is higher. Okay, that is contributed by poor conformation, which is a factor. Horses that are worked early, the bones are not mature, are not strong, but they are being put into work. There is a pressure or the demand for horses to be worked as early as possible in racing, in jumping, in dressage, in whatever. The earlier they work, the faster they earn the money, right? That's why in racing we have 2-year-old, we have 3-year-old, but remember, horses, the bone mature at 4 years old. So before the 4 years old, below this age, the bone are not strong. So it can cause damage if they are worked hard. And race horses are trained at 1 year plus, and some are raced at 2 years. Okay, so imagine for the hard work, it can cause what they call arthritis. General what they call flow or what happened in case of arthritis. Now, when there is an injury to the joint, we're talking about acute injury, for example, when there is injury in the joint, it causes inflammation in the joint capsule. This increases the or result in the joint capsule to produce synovial fluid, which is joint fluid, right? So the synovial membrane of the joint capsule produces fluid, which acts as a lubricant. So lubricating the joint and protecting the joint surface. But with injury, it results in formation of fibrinogen in the joint. There is an increase in the synovial fluid. That means the more the joint is traumatized, the more fluid is what they call produced or excreted into the joint to protect, to lubricate. Okay, but remember, okay, go back. I think there is a side note inside there, but it's missing. So what happens with the increase in synovial fluid with inflammation? Usually, the synovial fluid in inflamed joint, the hyaluronic acid, which is a component of the synovial fluid, is reduced. Hyaluronic acid determines the viscosity of the joint fluid. So, if the joint is inflamed, it produces joint fluid or synovial fluid, but with reduced what they call hyaluronic acid, so reduce viscosity. So what you have in the joint during trauma, in case of traumatic arthritis, for example, there is good efficient or good what they call amount of synovial fluid, but less viscous, poor lubrication that can cause damage to the joint. Okay, so those are general happening in the process of inflammation. Now, there are so many types of arthritis. Some are classified according to time. Some are classified according to condition, according to etiology or whatever. So, depending on which book you read and how it is defined. Some arthritis are termed acute arthritis or chronic arthritis. Immediate, it cases of trauma. Chronic, for example, in concussion, it takes time to develop slowly. The other generation, like other classification, like degenerative arthritis, traumatic arthritis, infectious arthritis. This involve bacteria like certain what they call coliform can cause suppurative arthritis, correct? And certain virus too. Some are related to what happened, osteoarthritis, new bone formation in the joint. These are chronic arthritis. Infectious arthritis are usually acute. Traumatic arthritis are also acute. Okay. Now, I did mention just now. The side, the side. This one was missing somehow. Okay. In an example of traumatic arthritis, In cases of traumatic arthritis, which means there is trauma direct, can be direct. The joint can be hit by a hard object from outside or concussion, right? Severe trauma causes inflammation. Inflammation of the joint capsule called syndrome, which I described just now, right? The persistent inflammation, it keep on producing what they call severe fluid, with less lubrication because of reduced hyaluronic acid. So the joint lubrication is poor. Because of that, it causes irritation to the joint surface, and slowly it causes damage to the joint, to the cartilage and to the bone itself. And with that, new bone is formed. So when it persists for a longer time, it results in osteoarthritis. Osteoarthritis is arthritis with bone formation. So it's chronic arthritis. So imagine traumatic arthritis is acute arthritis, finally end up into osteoarthritis. Okay, which is osteoarthritis. Yes, osteoarthritis is a degenerative condition because of damage to the joint surface, damage to the cartilage, resulting in new bone. Okay, I described just now. And an example of osteoarthritis is a condition called ring bone. Okay, this is layman's terminology, but it's accepted widely as ring bone. Ring bone is exostosis or osteoarthritis or new bone formation of the phalanx. Phalanx means P2, P1, P2, P3. These are the condition where what they call ring bone is. Usually, because it involves P1, P2, P3, or N, doesn't matter, new bone formation and osteo. So, if it happens, so sometimes when you read book, they classify ring bone into two, okay? Articular ring bones, okay? It is classified according to the whether it involves the joint or not. So it is called ring bone. Sometimes it's called articular ring bone. So articular means it involves the joints here. So in the P1, P2, P3, you have the pastern joint and the coffin joint, right? So if new bone formation is found at the area of the pastern joint or the coffin joint, these are termed as articular ring bone. You see this sunburst appearance, but bony structure there where the pointer is. Can you see or not? Can you all see? Okay, that's new bone. The new bone is formed in the joint. So any new bone formation in this area is called ring bone, right? The one that is in the joint of the phalanx is called articular ring bone. Sometimes book term it as true ring bone because it's in the joint. Sometimes you get injury of the periosteum on the shaft of P1, for example, or on the shaft of P2. Okay, without involving the joint. So, for example, if this one doesn't happen, except this one only. Okay, this is periarticular, not in the joint. They are ring bone, but to differentiate between true ring bone, they call it false ring bone. There's nothing false about it. A ring bone is new bone formation. True ring bone refer to in the joint. False ring bone refer to periarticular, not in joint. And why we differentiate? Because usually periarticular, I usually call it periarticular. Periarticular ring bone doesn't cause lameness because it's not in the joint. Articular ring bone or the true ring bone causes lameness, and that's what actually ring bone is. Okay, that's what arthritis is, the one in the joint. Sometimes they refer to location. This is layman terms, right? Low ring bone, high ring bone. Low, they indicate that the problem is around P2, P3, proximal of P2, P3. High ring bone is new bone formation in P1 or proximal P2. don't worry about all this separation. But more important, you know what ring bone is. Epidemiology, etiopathogenesis are all the same, and we are concerned about the articular ring bone. It's caused by trauma, direct, indirect. Trauma direct means when they're jumping, this leg hit the pole here, it hit all the time, causes the damage to the joint capsule and whatnot, and slowly it develops into new bone in the joint. So that's what they call ring bone. Continuous concussion. Horses being worked on hard ground all the time, like carry horses being ridden on the tarmac for years and years and years. Continuous pounding and injury on the joint causes new bone formation, ring bone. Heavy work, jump high, hard work, long distance work, work on the hard ground all the time, certain discipline of sport like jumping, polo, they make sudden turn, sudden move, sudden speed, that damage the joint, right? Chances or possibility of damage the joint is higher. When the joint is damaged, it forms new bone formation. I talk about work, horses work at young age. The bones are not mature. Poor conformation, poor distribution of weight on one side or the leg compared to the other. Okay, signs. It causes bony swelling. They see this? Some swelling here, heart swelling, and here. So, when there is problem in the joint, new bone formation, definitely it causes pain, right? So, the acute means all of a sudden sudden onset or lameness. Okay, you pick up the leg, you try to flexion might be a bit poor, but swelling is there. Obvious hard bony swelling, painful, which is lameness, right? It causes pain. Why differentiate the acute or chronic? Basically, I here to indicate that first time presented, but remember, most ring bones are chronic anyway because it takes time for the new bone to develop. But the presentation is acute. The first time is lame, it's acute lameness, right? When you examine, you see new bone formation or whatnot, definitely it's a chronic condition. But chronic sometimes people like to refer to first time is presented, then you have recurrence because osteoarthritis cannot be treated. It can be controlled only. So there is a lot of recurrence. The horse might be referred to you many times. So it becomes like a chronic regeneration. Lameness at work. Whenever the horse is worked hard, it will lame. Heart swelling here, swelling here, swelling there. And of course, if you take an X-ray, you see new bone formation, right? How to diagnose? We talk about clinical examination, history of lameness recurrent, for example, history or type of work, what they call type of distance of work, duration of work. These are all important history. Sign presented lameness. This is one aids for examination you can do. When you do a flexion test, in cases of arthritis, you get a positive flexion test. Positive means if they are not lame, they do a flexion, it becomes painful, they are lame after doing the flexion. Volar block also can be used to diagnose. And of course, X-ray is a new bone formation. You will understand all these aids or diagnosis in the practical lecture that I'm going to discuss. Right? Ini contoh. Normal. So you expect to see ring bones around this area, right? Yeah, you want all the way. So any information of new bone around this area, these are new bone. These are ring bones. So nice lateral view of P1, P2, P3 with coffin joint and peston joint. The top one here is padlock joint. So this is padlock joint, it should be here. Okay, nice clean. Okay, X-ray to normal oblique view. Usually for the joint to see the condition, we take a minimum of 4 views. Lateral, anterior, posterior, and 2 oblique view, medial and lateral, right? So now, remember the first X-ray, see this X-ray. Exostosis of the padlock and coffin. New bone formation there. And the coffin joint here, right? So this is ring bones. Okay, how do we treat? You have new bone formation. Actually, osteoarthritis cannot be treated, but it can be reduced or controlled. That's all. So they are incurable. You cannot treat them, but you can use you can give analgesics to reduce the pain. So, but of course, before people do ankylosis, because there's new bone formation there. If the horse being worked all while still, new bones are formed, and to such a chronic condition that the padlock, the pastern joint is ankylosed. That means fixed completely, not flexed. This can also be done surgically. Horses with ring bones, surgically open the area, curate the surface or the pastern joint, and it will heal this new bone formation. The tremendous amount of bone formation around the joint, it becomes ankylosed. So when the joint is ankylosed, there is no movement. If there is no movement, it's fixed, it's locked, there's no pain, right? So you don't see lameness. You are not curing the problem. You are just preventing pain. But remember, you probably be able to do in pastern joint, for example, in ring bone. But in any other osteoarthritis of the fetlock, of the carpal joint, or of the hock joint, they have all different names, same condition. You cannot ankylose the joint, because you ankylose the joint, the horse cannot be worked at all. In very expensive horses, when you think there's trauma to the joint, I did mention one of the etiopathogenesis, and the trauma damage the joint, so the new bone is formed. So in expensive horses, when you know of a trauma to the joint, you want to prevent new bone formation causing ring bones. You can use radiotherapy. Okay, put a radiation pad around the joint to reduce new bone formation. In the olden days, they do neurectomy, but neurectomy now is considered a welfare issue, inhumane. Horses cannot enter for competition or sport when they are neurectomized. Neurectomized means they cut the digital nerve. The digital nerve supplied where the pain is, where you remove the nerve or you cut, there's no pain. But remember, in neurectomy, we reduce the pain, but the horse is not feeling the pain, that's all. But the risk is that if there is injury in the sole, nail puncture or whatever, if the horse have hoof abscess and what, nobody knows, because it's not feeling the pain, it won't be able to show sign of lameness, right? But what you can do is to control when the horse is presented lame, you suspect ring bone, we treat with this anti-inflammatory injection. With the anti-inflammatory, condition settle down, the horse doesn't feel pain, and sometimes we maintain on oral anti-inflammatory, which is good. The horse might be back to normal, but remember, the condition is still there. The moment you work the horse, if the horse is on light work, you will feel pain, but the moment you increase the work, then it might still be lame. So recurrence is very high with or without using analgesic, and the value of the horse is also reduced, because in ring bone, for example, when what they call, you use analgesic, you still cannot use up to the optimum. If a horse used to do a high jump, or a horse used to do a long distance endurance ride, you cannot do that anymore, because there's a lot of concussion on the joint. It might not feel the pain if you use it for hacking, for children to ride around for half an hour, 20 minutes or so. It might not be the show pain, but the moment you surpass the level of work, it be painful. So the value of the horse is so reduced, because it's not in competitive level already. A good endurance horse, international level, or a good show jumping horse, grade A, might not be able to be used. You can only ride them or use for children to ride and whatnot. It's less demanding, right? So that reduces the value. So basically, in competing horses, in performance horses, it's bad news when they have osteoarthritis, and they will be of no value except for recreation only. Okay. Okay, that is condition of the bones. Now, what's the time now? Okay, another 10 minutes, I think. Condition of the tendon and ligament. I take tendon as a condition. So we have done muscle, we have done bones, we have done muscle, we have done joint, now tendon. Injury to the tendon. So we are talking about soft tissue, which is tendon. This one, we will do the various definition. I will skip. There are many conditions of the tendon and ligament, right? This is just definition for you all to know. Okay, one that I want to pick is tendinitis, which is inflammation of the tendon. The inflammation of the tendon is because of, they are caused by incoordinate movement, excessive stretching of the tendon. Tendon, we are talking about superficial and deep flexor tendon, the tendon structure behind or posterior to the tendon bone. Okay, or metacarpus or metatarsus. You have a rupture of this tendon fiber. So due to what? Due to coordination of movement, excessive stress, sudden stress, for example, horses stationary or sudden bolted, okay, stretching the tendon. Chronic stress is continuous. Riding for long distance, 100 kilometer, 120 kilometers, so keep on stretching the tendon. Because the tendon, when the horse trotter, landing and pick up the leg, there's continuous stretching of the tendon. So that causes damage to the tendon fiber. And if there is degeneration in the tendon fiber, it weakens the tendon fiber, it can cause what they call rupture. It's not rupture of the whole tendon, but the tendon fiber itself. So when there's damage to the tendon fiber, it causes acute inflammation. So acute inflammation in the tissue, soft tissue, causes heat, just inflammatory sign, right? Heat, pain. So it's seen by lameness. So you see all cases that we discuss are lameness. Swelling of the area of the tendon. You see the swelling, swollen tendon? You can feel lameness. Okay. How you diagnose? History of lameness of presented. When you look visual examination, you can see the tendon swollen already. So you want to confirm, you trot the horse, you will see that the horse is swollen or is lame on this particular leg. Brought to you, you do detailed examination, palpation, you palpate, there is heat, you put pressure, there's pain, and you feel the swelling as well. Okay. Once the tendon heals, they heal by fibrous tissue. Fibrous tissue is quite big, so the swelling can be permanent. So it becomes a chronic tendinitis now. First time happened, acute tendinitis, but with treatment, with healing, with fibrous tissue formed in the tendon, it becomes thickened. But remember, tendon fiber don't heal by new formation of tendon fiber. Tendon fiber cannot regenerate. So once that's damaged, the tendon fiber healed by fibrous tissue. The fibrous tissue is not as elastic and as strong as tendon fiber. So when the horse is worked again, the tendon is less elastic. You work them be hard, it will rupture at where the previous rupture is. So that's chronic tendinitis. It causes swelling, thickening. Sometimes they call it bow tendon. It's like a bow, right? Slightly curved in shape. Okay. And recurrent lameness. I did mention just now, tendinitis healed by fibrous tissue. The fibrous tissue is not strong. When the horse is worked, you stress, the fibrous tissue break, you get recurrent tendinitis. Treatment still, you see, one thing about horses, most musculoskeletal treatment, one common treatment is rest. It's now also rest, this is also rest. You rest them because it takes 3-4 months for the fibrous tissue that forms at the tendon fiber to be strong. So you need the strength, they have got to be rested long. 3, 4, 6, 8 months. Anti-inflammatory to reduce the pain and to reduce the swelling. Okay. Analgesic, anti-inflammatory together, right? There are surgical procedure, but I'm not going to discuss in detail on surgical procedure, like what they call putting tendon fiber and whatnot to strengthen the tendon. So we are not going to discuss that. This is another application. This is a poultice. poultice can be used. Poultice can be used to fasten up the reduction of the swelling, right? Warm poultice. Okay? You okay? Okay, before that, yes. Any question? Yeah. Siapa tu?
And for me, we're okay.
Okay. Now, quickly for 5 minutes, because this is another one for you to know. So, I've discussed muscle, I've discussed joint, I've discussed ligament, tendon together, right? You have tendon, there's tendonitis, you have ligament, there's desmitis, not ligamentitis, yeah? Remember. Now bone straight. Just now bone together with joint, so it's in the joint. Bone by itself. Common example case is bone fracture. Correct or not? Break in the continuity of the bone. Metacarpus, right? Yeah. There are many type of fracture to show you some example. Okay. Small fracture, spleen bone. This is chip fracture. This is just complete fracture of cannon bone. Okay. All those metatarsus, right? So slap fracture, big piece. Okay. Etiology is of course trauma. Usually, seldom it is pathological like ace of fracture. Okay. In case of trauma or the bone or the animal is fatigued, it fell down, something like that, or the bone fatigue. Pathological is the damaged bone because of resorption of calcium and whatnot. It becomes more brittle. Okay. So signs again, you see the again lameness, abnormal posture or gait, for example, not supporting weight, swelling at where the fracture is, pain is of course lameness, loss of function. Sometimes it involves the like this one, there's radial nerve paralysis too. So that's neurological, right? Diagnosis. Quickly, the flow of the after I will wrap up in the physical examination practical class. Diagnosis history of fall, history of trauma, history of anything, not by car, kicking the wall, kicked by another horse. So get the history. Sign, lameness in cases of fracture, and usually fracture lameness are grade 4 or grade 5, non-weight bearing or severe weight bearing lameness. So lameness and swelling at where the fracture is. If you palpate the area in your detailed examination, you can feel crepitus, movement of the two piece. How can you confirm? You have differential fracture. Take an X-ray like this. Elliptical fracture of the condyle or the metacarpus, right? See that? I think I don't have to go detail. You learn about fracture in surgery class, reduction, fixation, immobilization. But I want to stress on this. In cases of fracture repair in horses or in large animal, okay, there is a lot of constraint, either related to the injury, type of injury. He fell down. There's so many places of fracture. Open fracture causes infection, very difficult to treat. Osteomyelitis. Horses are big. Okay, when they are big, it's difficult to you can reduce, but immobilization is difficult. Equipment is difficult. Depend on where the fracture is. If you have a fracture of humerus or femur in a horse or in large cattle, it's quite impossible to treat. There's no what they call pins, no screws that is strong enough, and the animal weighs 400, 500, 600, 700 kilo. Whatever cast you put, whatever fixation you do, it's not going to stay, right? So these are constraints. So it depends on the location compared to fracture of spleen bone, fracture or spleen bone, for example, or fracture or fracture or carpus, easy to treat. So it depends on the location though. Facilities available. Horses, it might fracture in the field, lot of contamination, lot of infection. Whether facilities is available there, you have got to bring the animal, the horse to large animal hospital, and even that there's not enough equipment that's strong enough. There's no strong screw, pin, plates or whatever that you can put in the humerus or femur of adult horse wearing 600 kilo. So these are constraints. And cost too. The bigger the stronger the equipment, the longer the cost of treatment and whatnot is going to increase the cost easily, thousands to tens of thousands. So you have the horse of little value, cost of treatment is high, then you're talking about economic factor, right? These are not pets. Yeah? So economic factor is important, right? They are not producing. Once a racehorse broke its leg, it's not going to race anymore. It's going to be rested. So it's not going to bring income. So that's economics, right? So these are important. So there are many other constraints. So read through what are the constraints in fracture repair. Okay. I have an example here. Although I go fast, do you see all the notes here?
Yes, sir.
You read the notes, then it will explain. So that's why, because time is a constraint, so I got to go fast, and more difficult is online. But all my notes, this one is specially prepared for online presentation for you all to read. I did it last year to benefit your class, so I think you all benefit tu lah. Macam ni ya. So you just read a bit. Okay, you read, I think you will understand. So try to read, and any comments, any question, you can get back to me. You read now, you can bring it to me during the practical class, or if not, you can always discuss with me through email or WhatsApp or whatever if you have any question. Okay, I think most of my slides have got footnote, important footnote like that, right? So very detailed. So read. Okay, then you will understand better. That okay?
Okay, Prof.
Okay, Doctor.
Okay, you have any more questions? Yeah.
Oh, sorry, yeah, I just have a quick question lah. Just wanted to confirm regarding tendinitis kan. Chronic tendinitis kan, they always get like recurrent lameness kan.
For tendinitis, yes.
Yeah. So once they suffer from tendinitis, and then if they recover, there's a chance of them getting recurrent lameness kan. So once they recover kan, can they still participate in macam endurance racing semua tu?
Usually most horses that come down with tendinitis do not have a future of competitive high level event. Reason is, as I mentioned just now, whenever tendinitis means there is rupture of tendon fiber, because tendon is made up of millions of fiber, right? Those portion that is ruptured it will be replaced by fibrous tissue. Fibrous tissue is not strong. So when the horse is worked at the competitive level, there is continuous stretching of the tendon, right? The excessive stretching of the tendon will rupture or we break at where the repair is. That's why recurrence is very high in tendinitis. Cases of tendinitis recurrence is very, very, very high, number one. And it occurs whenever the horse is being worked hard. For example, a horse that is used for 120 kilometer endurance, when he has tendinitis, he has no future up to 120 kilometer. Maybe you can ride for 30, 40 kilometer, that's all. So economic loss, and yes, it can go back to work, but light work, no, because risk of hard work, competitive work is recurrence. Okay, re-rupture of the tendon fiber at where the repair was. Okay, that answered the question?
Yes, thank you so much.
Okay, any other question? Okay, kalau tak ada question, tak apa, you read. Anything you don't understand, we can discuss. We can start at 2:30. We can start with what they call question and answer first. Things that you are not clear, I might be fast. That I admit I'm fast because there are so many things to recover. But you can depend on the notes there. After the question and answer, we go and do the practical. Okay. Okay, then I will see you this afternoon at 2:30. Bye then.
Okay, doctor. Thank you so much.
Thank you.
Bye then.
Thank you.
Bye. Take care.